Hey guys, so this is the review on obstructive sleep apnea, or OSA, from chapter 29. Hi guys, this is the review for OSA, or obstructive sleep apnea, from chapter 29, and basically this is a breathing disruption in patients during sleep that lasts at least 10 seconds for a minimum of 5 times an hour. And they usually are going to be at higher risk if they're obese, if they have a large uvula, a short neck, if they're a smoker, if they have enlarged tonsils or adenoids, and then if they have oropharyngeal edema. So, sorry, my leg's falling asleep. So the symptoms we're going to see in these patients, they're usually going to have excessive daytime sleepiness, irritability, an inability to concentrate, and then a lot of these patients are going to have heavy snoring. So for long-term effects of obstructive sleep apnea, primarily if it's untreated, is they're going to be at a higher risk for hypertension, higher risk for strokes, cognitive deficits, weight gain, diabetes, pulmonary and cardiovascular diseases. And we can give them the Stop Bang Sleep Apnea questionnaire. And if they score more than 3, then they're at an increased risk. So the higher their score, the worse it is. Also, the gold standard test for diagnosing obstructive sleep apnea is going to be an overnight sleep study, which will usually include an EEG, an ECG, and an EMG. And they'll have electrode little things attached to their head. I've had a sleep study. Probably several people in our class have had sleep studies. So it's a little bit uncomfortable, but you eventually fall asleep. Then they wake you up at 5 a.m. So they can get all that good information. As far as the least invasive treatment, we can look at having the patient change their sleeping position, weight loss, and then position fixing devices for basically preventing tongue subluxation. So it keeps their tongue forward. But if those things do not work, then they can try non-invasive positive pressure ventilation, or NPPV. Basically, that's going to use positive pressure to keep the airway open. Most patients are going to be on a CPAP that has continuous pressure, or they can do the bi-level airway pressure with the BiPAP. So I'm sure most of us know someone that uses these machines at night. If you don't, just YouTube it. I'm sure there's plenty of videos with people who are using them, As far as medications, they can try modafinil. Modafinil is a stimulant, so it promotes wakefulness, and it also helps with cognitive issues. So for surgery, they can, if nothing else works, they can do surgery. So they could do an adenoidectomy, a uvulectomy, or a UPP. That's a uvulopalato-pharyngioplasty. My mom actually had this surgery. She has Parkinson's, and she used a CPAP for a long time, and eventually they did this surgery. So they go in and they scoop out the uvula and the upper palate, the tonsils, the adenoids. Like, they are just kind of going in and taking out everything. It's extremely painful. My mom actually regretted doing it because it was so painful, but she no longer needs the CPAP machine. So it worked, but very invasive surgery. And then they can also use a trach if necessary. So that is pretty much all of the OSA info from chapter 29. Let me know if you have questions, and we'll go from there. Thanks.